Good morning and welcome to News for Hearing Impaired. I'm Shubhendu with my colleague Manisha. Let's begin with the headlines. Cabinet Secretary asked states to take steps on war footing to trace attendees of Tablighi Jamat congregation in Delhi. Health Ministry says increase in number of coronavirus infections due to Tablighi Jamaat congregation. Union Health Minister Dr. Harshvardhan holds meeting with Indian Medical Association to review the preparedness and action to deal with COVID-19 crisis. Says prevention, containment and management of COVID-19 are being monitored at the highest level. War against corona continues across the world. The number of infected people have now crossed 9 lakhs. UK registers more than 500 deaths in single day. In United States, death toll crosses 4,500. The National Investigating Agency registers case against terrorist attack on a Gurdwara in Kabul, Afghanistan, killing 27 devotees, including an Indian citizen. It is the first such case registered by NIA related to an incident outside of the country. And this year's Wimbledon cancelled due to corona outbreak will be held in July next year. This has happened for the first time in history after World War II, when the premier tennis tournament has been cancelled. The situation of coronavirus spread due to infected members of Tablighi Jamaat has become grave throughout the country, with more than 200 delegates reported corona positive. At least 9 people have died who had attended the congregation in mid-March in capital Delhi. Centre has taken up the challenge of identifying the delegates and the people with whom they came into contact to contain the damage. In this regard, Cabinet Secretary Rajiv Gauba yesterday held a high-level meeting with Chief Secretaries and DGPs of the states through video conferencing and asked them to track the Jamaat members on a war footing so that preventive measures can be taken up to contain the infection. Even the Health Ministry has now confirmed that the sudden spike in number of corona cases in the country in the past 24 hours is largely due to the infected delegates from the congregation of Tablighi Jamaat in Delhi. These delegates then spread all across the country, coming into contact with thousands of other people, multiplying the infection. As the nation completed 7 days of lockdown, active cases of COVID-19 reached 1,649. 143 people have been cured of the infection and have been discharged from hospital, while a total of 41 people have died due to the virus. Centre and states are working together to contain the spread of the virus and trace contacts of the affected people. Briefing the media, Health Ministry has said that as many as 6 lakh people are living in makeshift camps. Over 25 lakh migrant workers who were rushing home were provided with food at relief camps. Centre has also said that 47,951 tests have been conducted till date. There are 126 labs in ICMR network, including 51 private labs that have been approved. Union Home Ministry has issued consolidated guidelines on lockdown measures to be taken by ministries, Department of Government of India and states and union territory to break the chain of transmission of COVID-19 in the country. It was observed that some states, union territories are allowing exceptions beyond what has been permitted under the lockdown measures, as contained in the consolidated guidelines issued by MHA under Disaster Management Act 2005. In pursuance of this observation, Union Home Secretary Ajay Kumar Phalla has written to all state chief secretaries and union territory administrators requesting them to strictly implement lockdown measures in letter and spirit. by exercising their powers under the Disaster Management Act 2005 to fight COVID-19. Union Health Minister Dr. Harshvardhan reviewed the actions taken and preparedness on novel coronavirus with Indian Medical Association at a high-level meeting through video conferencing in New Delhi. During the meeting, he reviewed the preparedness and concerns of medical staff across the country related to COVID-19. The minister reviewed the status of preparedness in terms of availability of beds, isolation wards, lab readiness for high test volumes. He again appealed to the nation that doctors and healthcare workers should not be ostracized or targeted. Instead, they should be lauded for their efforts in helping the public at large. The minister said IMA and its regional members will make a task force and take proactive role in helping the official machinery at the state, district and local levels.
हमने उनको ये अपील की है कि अपने अपने स्टेट में अपने अपने डिस्ट्रिक्ट लेवल पर और जहाँ जहाँ हमारी आईएमए की जो है ब्रांचेस हैं उनके लेवल पर प्रोएक्टिवली वो एक टास्क फोर्स बनाकर और वहाँ का जो एडमिनिस्ट्रेशन है उसको पूरी तरह से मदद करें और हमें आईएमए की तरफ से प्रोएक्टिवली ये सुझाव भी दिया गया है कि वो सब पूरी तरीके से इस कोविड के खिलाफ जो जंग है उसमें सफलतापूर्वक जो है उसको जीतने के लिए पूरी तरह से जुटे हैं.
Union Health Minister Dr. Harshvardhan has stated that prevention, containment and management of COVID-19 are being monitored at the highest level and various actions have been initiated in collaboration with the states. In an exclusive interview to DD News, he reiterated the resolve and said the government is committed to prevent the spread of COVID-19 and it will take all extreme and preemptive steps available to stop its spread.
We have a well laid down criteria which is quite thorough and comprehensive, where we are even testing every patient who has an acute respiratory illness and is admitted in a hospital. He is also being tested. It's not only a person who has a history of contact with a COVID affected or an international travel, but it is also a person who has an acute respiratory thing.
And he also said that India is following a laid down criteria to do all the testing.
Community surveillance that we started on 17th of January. Can you believe it, when I am talking to you today, we have more than 5 lakh people in this country who are under community surveillance, and our health system with the help of our other you can say grassroots workers like surveillance officers and the rapid response teams etc. and ASHA workers. We are keeping a, you can say, very close watch on these people. If he or she is an old person, so virtually it's a daily contact with them. So a watch is being done with the help of all the officers of the and the administrative machinery. We are being helped by the Home Ministry people. We are being helped by the DMs. We are being helped by. It's not only the health department, it's the whole government which is working.
The Press Information Bureau of Ministry of Information and Broadcasting has set up a portal, COVID-19 Fact Check Unit, that will be operational from morning of 2nd April 2020 to receive messages by email and send its response in quick time. The Ministry of Health has set up a technical group comprising professionals from AIMS, etc. to clarify any doubts in the minds of general public on any technical aspect of COVID-19. The Cabinet Secretary has written to all state governments informing them of the constitution of 11 empowered groups under the Disaster Management Act with clear-cut mandate to decide on various aspects of management of COVID-19 with the request to develop similar mechanism at the state level. Health Department has issued detailed guidelines to deal with psychological issues amongst migrants. State governments have been requested to engage volunteers to supervise the welfare activities of the migrants. The Press Information Bureau will release a daily bulletin at 8 p.m. every day to inform regarding government's decisions and developments and progress on COVID-19. The first bulletin was released on Wednesday at 6:30 p.m. In view of COVID-19 outbreak, Central Board of Secondary Education (CBSE) has decided to promote all students of classes 1 to 8th to the next class. The students of class 9 and 11th will be promoted to the next class based on school-based assessments, including projects, periodic tests and term exams conducted so far. CBSE will conduct class 10th and 12th examinations only for 29 main subjects that are crucial for promotion and admission to higher educational institutions. Prime Minister Narendra Modi in a tweet urged people to have a look at the Ayush Ministry protocol and make it a part of your lives and share it with others as well. His tweet further says, "Let's keep the focus on being healthy. After all, good health is harbinger of happiness." Prime Minister Narendra Modi had a telephonic conversation on Wednesday with Sheikh Sabah Al Khalid Al Hamad Al Sabah, Prime Minister of State of Kuwait. Prime Minister Modi conveyed his greetings and best wishes for good health of the Emir of Kuwait, the royal family, and the people of Kuwait. They underlined the importance that India attaches to its relations with Kuwait, a valued member of India's extended neighborhood. Both leaders discussed the domestic and international aspects of the ongoing COVID-19 pandemic. They agreed that their officials would maintain regular contact during the health crisis in order to exchange information and explore avenues of cooperation and mutual support. Kuwaiti Prime Minister stressed that the state of Kuwait greatly values the contributions of the large Indian community in Kuwait and would continue to ensure their safety and welfare in the present situation. Prime Minister expressed his warm thanks and appreciation for this kind of reassurance. Contributing towards efforts to contain COVID-19 pandemic and a gesture of goodwill towards local population under distress during the nationwide lockdown, Goa Naval Area undertook distribution of essential supplies yesterday. The headquarters of Goa Naval Area coordinated with the councillor of Mangor Hill and distributed critical supplies to families of daily wagers, migrant labourers and low-income families at Gandhinagar near Ayappa Temple, Varunapuri. In addition, provisions were handed over to Milad Naik, Minister for Urban Development and Social Welfare, for distribution to families in need. During the lockdown in Leh Town, Municipal Committee is sanitizing all public places with sodium hypochlorite. For the last 10 days, the MCL has been sanitizing the main bazaar, bus stand, bank premises, ATMs, shops of medicine and essential commodities, and other shopping spots where public movement is found. The MCL has also sanitized Raj Bhavan and public offices as well.
अभी 5-6 दिन से चल रहा है, जहाँ जहाँ पब्लिक का गैदरिंग का ज़्यादा स्कोप होता है, जैसे बैंक्स हुआ, एटीएम्स हुआ, फिर आपका जहाँ पब्लिक डीलिंग के ऑफिसेस है, इसी तरह के आपका पेट्रोल पंप वगैरह. अभी हम पेट्रोल पंप ले का सैनिटाइजेशन कर रहा है. अभी हमारे पास काफ़ी मकदार में केमिकल आया हुआ है, तो इसका कोई परेशानी नहीं है. जहाँ जहाँ से भी डिमांड आएंगे, इवन आउटसाइड म्यूनिसिपैलिटी से अगर रिक्वायरमेंट का हमें कोई डिमांड आता है, तो हम वहाँ भी सैनिटाइजेशन का प्रोग्राम चला सकते हैं.
The MCL has also made hand washing arrangements at various locations. Besides, door-to-door waste collection is intensified to make public not come out of their homes during the lockdown. Leh is observing lockdown religiously, excepting the chemists and few general stores in the main bazaar and other places. Generally, the business establishments in the town are closed. Shops are strictly following the social distancing while in operation. More than 9 lakh cases of coronavirus have been officially detected worldwide since the pandemic emerged in China late last year. Over 9 lakh infections, including 45,719 deaths, have been recorded in 187 countries and territories globally, with 203,608 cases and 4,476 deaths in the United States, where the pandemic is spreading rapidly. Italy, with 110,574 detected cases, has the highest number of fatalities with 13,155 deaths. Spain has 102,136 cases, including 9,053 deaths, and China has 81,554 cases and 3,312 deaths. World Health Organization has said it was deeply concerned about the near exponential escalation of the new coronavirus pandemic as the number of deaths doubled in a week. WHO chief urged citizens around the globe to stand together to fight COVID-19. The organization also warned about the serious social, economic and political consequences in the African region that could turn up if confirmed cases of COVID-19 started spreading. WHO chief urged governments to implement social welfare measures to ensure that vulnerable people have access to food during the crisis and called for debt relief for poorer states. Meanwhile, he also mentioned that a safe vaccine is thought to be 12 to 18 months away and recommended people to wear masks who are infected or are health workers. A Russian military plane carrying medical supplies has arrived in the United States. The plane landed at New York, the epicenter of coronavirus outbreak in the US. Russia has previously sent medical supplies and experts to coronavirus-hit Italy as part of humanitarian efforts. The US now has more than 206,000 confirmed coronavirus cases, by far the highest in any country, and over 4,500 casualties. In Colombia, the police is resorting to creative methods to urge citizens to stay in their homes during the quarantine to prevent further spread of coronavirus. In Medellin, a funeral car was used to issue alert messages for citizens to stay in their homes during the state of emergency. In the northern Colombian city of Barranquilla, police used drones with loudspeakers to warn people to stay at home. However, Colombian police also entertained the people by singing. Since Wednesday, Colombia began a nationwide lockdown until April 13th, with strict movement restrictions across the country designed to reduce community spreading of the virus. Colombia has reported 702 cases of the disease and 3 deaths so far. National Investigation Agency has filed an FIR to probe the terror attack on a Gurdwara in Afghanistan's capital Kabul last month. The case was registered under various provisions of Indian Penal Code and anti-terror law. Banned terrorist organization Islamic State, Khorasan Province ISKP, has claimed the responsibility of this terror attack. The agency said, as per the preliminary investigation, one Mohsen from Tirkaripur, Kasargod, Kerala, and others who had joined ISKP are suspected to have been involved in the terror attack. This is the first case of its kind where NIA has registered, as recent amendments in the NIA Act have empowered the agency to investigate terror cases that are committed at any place outside of India against Indian citizens or affecting interest of India. 27 people were killed in the attack. President and Vice President extended greetings on the eve of Rama Navami. President Rama Kovind in his message said, "On the auspicious occasion of Rama Navami, I extend my greetings and best wishes to fellow citizens. Rama Navami, celebrated as the birth anniversary of Maryada Purushottam Shri Ram, is also an occasion for our toiling farmers to celebrate new crops. Shri Ram's ideal life gives us the message of virtue, tolerance, warmth and harmony. We should sincerely follow these eternal values in the course of our duty. On the festive occasion of Rama Navami, let us resolve to follow Shri Ram's ideals in our lives and to build a glorious nation. Also follow all government guidelines, including social distancing, while celebrating the festival to combat and defeat the pandemic of COVID-19 virus." Vice President M. Venkaiah Naidu also shared a message. He said that by imbibing the values exemplified by Shri Ram, we can usher in a world that is inclusive, healthy, prosperous and sustainable I convey my warm greetings and best wishes to all on the auspicious occasion of Rama Navami. This day marks the birth of Lord Ram, who is an embodiment of timeless values of truth, righteousness, honesty, compassion and commitment to human welfare. He represents the qualities we look for in an ideal human being. May this festival bring health, happiness, peace and prosperity in the lives of all our citizens, and may we have the courage to collectively combat the major health challenge we are currently facing. Wimbledon has been cancelled for the first time since World War II because of COVID-19 pandemic. The tournament was due to be played between June 29th to July 12th. The entire grass court season has been abandoned, and there will be no professional tennis anywhere in the world until at least 13 July. Wimbledon is the latest major summer sporting event to be called off, with Euro 2020 and Tokyo Olympics also postponed for 12 months. It follows the postponement of the French Open that was due to begin in May but has been rescheduled to 20th September to 4th October. With the Premier League at a standstill along with the rest of the sporting world due to the coronavirus pandemic, Liverpool players, manager Jurgen Klopp and backroom staff checked in and gathered online ahead of remote yoga session. Echoing the club's mantra to stay home, save lives, in line with the overall message to keep in touch and stay active together with family and friends, the players joined online one by one. English soccer is suspended until at least April 30th due to coronavirus crisis, but the current season can be extended indefinitely, the English game's governing bodies said in a joint statement on March 19th. UEFA bowed to the inevitable on Wednesday and suspended all Champions League and Europa League soccer matches until further notice due to the coronavirus pandemic. European soccer's governing body also said all national games scheduled for June have been postponed, including playoff matches for Euro 2020, which has been moved to 2021, the finals of Europe's Elite Champions League competition, second-tier Europa League and Women's Champions League, all of which were scheduled for May, had already been postponed. A mini-tournament to decide the Champions League and Europa League is expected to be one option put forward to ease fixture congestion caused by coronavirus crisis. Wednesday's video conference call of UEFA's 55 member associations included a broad-ranging discussion on the crisis and what options might face the game in the coming weeks. These days, when many companies are witnessing layoffs, one must think out of box to stay in business. One such initiative was taken by Austrian physiotherapist Roman Palias to treat his clients inside a box. Many of Roman's clients are athletes who rely on their physio sessions to overcome injuries and to keep up their training. Palias made the cubicles from plexiglass attached to a wooden frame. The athletes train in contained units, and he, wearing a face mask, gives instructions from the other side. Such an initiative will surely inspire many others to adopt non-conventional measures and keep going. And with that, we conclude this bulletin. Take good care of your health. Namaskar.